All right, I'm going to start admitting people.
Okay.
Ding, ding. So we have 4 people. All right. Let's go here. All right, I'm just setting up on Facebook Live.
I don't even know how that works.
More people. Hey, everybody, we're about to get started here. All right. Who else? Going. All right. All right, we'll start in about 30 seconds. Just setting this up now. All right. I think we're live. All right, I think we're live now. All right, so hey, thank you everybody for joining us today. It's my pleasure. We have Dr. Nicole Fujiyama here, who is a naturopathic doctor and a acupuncturist over here in Torrance, so local practitioner here, and wanted to know more about what she does and how she can help my clients here at OsteoStrong, but also for me, selfishly, to learn more about what she does, right? And what her specialties are. So she's been here at OsteoStrong and taken a tour here. And she's really just like a few blocks away from us, so very, very close. But anyway, hi, Nicole, and welcome. And the video is yours now.
Okay. Hi, everyone. My name is Dr. Nicole, and I am a naturopathic doctor and acupuncturist. And if you're not familiar with what a naturopathic doctor is, basically I am a general medical doctor, but I have an emphasis on all the natural therapies, so which we learn in school, which include herbal medicine, homeopathy, nutrition, IV therapy, and that's kind of the base. So we really take Western medicine and natural medicine and combine it. So we have the best of both worlds. And here in California, I am licensed and I can prescribe medications, including hormones. And I can do injections and IVs and labs and yeah. So that's just kind of the gist of it. And my practice tends to focus on a few groups. So I do work with chronic disease a lot, usually men and women who are looking for a more natural alternative to taking prescription medications. So I work a lot with chronic illnesses and also autoimmune diseases. I also work a lot with women who have fertility issues and also just kind of general concerns. So stress, anxiety, and I tend to combine natural medicine and acupuncture together in visits because I think they work really well together and they really fill in the gaps. And so today I wanted to talk about aging and healthy aging and how that affects your immune system, just because that is a really big topic going on right now. And especially with the virus and also with the vaccines coming out, you know, as you age, your body reacts differently to both those things. So I kind of wanted to talk to you about that. And then if you have any questions, I'm super happy to answer them. And should I share my slideshow?
Yeah, you can do that.
Okay. Okay.
Together.
Okay, let me see if I can.
Remember, screen share.
Oh shoot. Okay. Oh yeah, screen share. Yeah. I forgot that step. Okay.
There we go. Perfect. All right, and then go ahead and present mode.
Okay, let me see. Home. Oh, slideshow. Okay. Okay, here we go. Okay, so I wanted to talk. Oh, about aging because it's becoming a really big population, not just in the US, but in the world. So people age, and when I talk about older adults, I'm usually talking about age 60, 65 and older. And that right now represents over 11% of the world population, and is expected to rise to 22% by 2050. And this is really important because there's going to be an increase in age-related type diseases, and we're seeing a lot of that now. So that's cancer, that's infections, that's cardiovascular disease, that's also neurodegenerative diseases. So, as the population ages, you're going to see these diseases also increase. And one thing I want to talk about with as you age is something called immunosenescence. And that is the decline and the deterioration of your immune function as you age. And this is really important because it doesn't really get talked about a lot, or I don't hear people talking about it a lot, because it affects both your innate and adaptive immune system. And that is going to affect how your body responds to any infections and also to vaccines. So I'm going to talk a little bit more about that later, but it's actually really important. And so again, immunosenescence is a state where your immune system and your immune function starts declining, and that can really start increasing and can also be a possible reason why older adults tend to get more infections, autoimmune diseases, and cancer, but we're actually seeing that a lot too in a lot of younger adults. And, a lot of times it's due to secondary conditions. A lot of chronic diseases are due to environmental factors. Genetics plays a part of it, but really the majority of it, like 70% and above, has to do with environmental factors. So that's your lifestyle choices, like what you're eating, oxidative stress, which is a natural occurrence in your body, but it can occur, you can get more of it through outside influences like air pollution, smoking or secondhand smoke, things like that. And even if you are free of all these environmental toxins, you will still, they're finding in older adults will present with immunosenescence. So it is a natural state of aging, and that's part of a lot of the research going on now is they're looking at how to actually stop that or halt that. And yeah. And so this is just going into more detail about how when you're looking at these sentient cells, how it's affecting your adaptive immune system. So that's your T cells and your B cells. And this is really important when it comes to things like vaccines and also infections, and your body remembering the infections that you have so that when it sees it again, it can mount this response, which is the same as with a vaccine. The vaccine is more a synthetic version of that. But as you age, your immune cells just don't work as well, and you don't produce as much of these antibodies in order to mount this response. And so that's where the immune function starts declining. And then it increases your risk of more infections. Okay, and then so these are just some images of some things that can contribute to immunosenescence. And again, it is a natural occurrence in your body, and they think that it does help to contribute to certain pathologies like I talked about. So like cancer and inflammatory diseases, and inflammatory diseases is actually really important. And there's something called inflammaging that I'm going to talk about a little bit more that is actually contributing to immunosenescence. Okay, and so these are some things that actually can influence your immune function besides just aging, but it's your nutrition. So what you're eating is super important. Again, these are all environmental lifestyle factors that you can adjust and control right now. Exercise, leading a sedentary life can actually make you more prone, more at risk for these infections and chronic diseases. And again, environmental factors, and that could be toxins, that could be toxins in your food, heavy metals, again, low grade chronic infections that you may not know about, stress, sleep, lots of these things. And then over time, they can start breaking down your immune tolerances. So that includes your barriers. So that's your skin is a barrier, your gut is a barrier, your lung is a barrier. And so over time, these environmental factors can start actually breaking down these barriers, making you more at risk for infections and also chronic diseases and inflammatory diseases as well. Okay, and these are, again, some ways to counteract the effects of immunosenescence, to really counteract the effects of aging, I guess you could say. So healthy aging, and that's, again, proper nutrition. And whenever people ask me about what proper nutrition is, I just tell them that it's a diet and foods that don't give you any symptoms. So that can really be anything and a lot of things for many people, because our bodies are so different and unique, and we're also dealing with different things and living in different environments. And also just proper vitamin and nutritional supplements. One of the things that hasn't really been emphasized, I feel like, in this whole pandemic is taking care of these nutrients and your vitamin status, things like vitamin D, vitamin A, vitamin E, vitamin K. A lot of these fat soluble vitamins are really important for your immune function. Macro and micronutrients are also really important. Minerals, things like magnesium, zinc, selenium are super important for your immune system. And again, just trace minerals in general. Hormone therapy. As you age, your hormones change, and that can also affect your immune system. So things like estrogen have an immune modulating effect on your immune system, meaning that they help balance it out. So, as you head towards menopause, that can start affecting your immune system as well too. And even in young adults, if they're having menstrual issues, that can affect their immune system as well. Exercise, like I said before, really important to help maintain your immune function. And then if you're living or leading a sedentary lifestyle, then that can really decrease your immune status as well. Sleep is huge. Sleep is really important. And it's not just the amount of sleep you get, but a continuous amount of sleep that you get. It can really affect your immune system, but also your metabolic health as well too, which can lead towards more inflammation, more things like weight gain, and that can lead to more inflammation, which leads to a lot of these like inflammatory diseases and chronic diseases. Stress, super important as well too. And herbal immune support, there's a lot of herbs out there to help your immune system, and they help different parts of your immune system. So, and that depends again on the person. There's some people who have autoimmune diseases and their immune systems are kind of more shifted towards one way. So if you give them a certain herb that say is really good for an immune system, like mushrooms or something like that, for some people that can actually make them worse. But there's a lot of Western herbs, there's a lot of Chinese herbs as well too. Chinese herbs are really good actually, and particularly now with everything going on, there's a lot of Chinese formulas that are actually really good. Let's see. Oh, and then this is the inflammaging that I was talking about. This is the chronic low-grade systemic inflammation that's really common as we age. Even if you don't have any sort of infection or chronic illness, it's just, again, as you age, they're finding in research that you just have this like background inflammation, and they term that inflammaging. And that can actually put you at a higher risk as you get older to these age-related diseases and also inflammatory diseases. So, and that can contribute to the immunosenescence as well too. And two markers that are really important when it comes to systemic inflammation is a C-reactive protein. So that's CRP, that's usually getting tested a lot in labs. And also interleukin 6, the IL-6. Both of these are associated with increase in aging. And then again, like I said, oxidative stress is a natural part of our bodies, and it's just part of our biochemistry, but that can also increase with age. And what happens if you start having more oxidative stress than antioxidants, that's what really balances out. If you're not either getting the antioxidants from your nutrition or from your diet or from supplementation, then you start having this imbalance and you start having more oxidative stress, creates more inflammation in your body and starts damaging your cells as well too. And then that can lead to more of that inflammation and chronic disease. Okay. And then, so this is kind of what I want to talk about too with the vaccine. So it's really, and then I haven't heard anyone talk about this like in the mainstream media, which I thought is really interesting. But, you know, the key aspect to an aging immune system is that there's a decline in, or there's not as strong of a response to these vaccines. And so, you know, it can lead to an initial response or a reduced efficacy of the vaccines. And, you know, they're still working on this, even with the flu vaccine. They haven't really figured this out. But what they tend to do then is they tend to give people multiple doses, you know, of a vaccine. And especially if they're older, they'll give them not just one, but like 2 or 3, you know, and they put these adjuvants in it, which are supposed to stimulate your immune system. But what happens is some of these adjuvants can actually contribute to more inflammation, and it can actually contribute to things like autoimmune disease for people. And again, if your immune system is already dysfunctional or declining, then that is not a good, it's not a good mix. And what else was I gonna say? Oh, and then with this new vaccine that they're pushing out, you know, that's a totally different vaccine. So they haven't really done studies with giving a new vaccine in an older adult population. So a lot of the vaccines that they're giving now, they're actually like booster vaccines, you know, so a lot of people have already had the vaccines when they're younger, when their immune system was a lot more robust, when it was functioning really well, you know, and now with this new MNR or mRNA vaccine, you know, this is just a totally new vaccine. They actually don't have, they never made a vaccine like this before. And so, and they haven't done long-term studies on this vaccine. So, you know, I don't know what's going to happen to people and how their responses to their immune system, especially in the older population, which they usually don't have many studies on that, just in general anyway, with things like the flu vaccine and for my research. Oops. So these are just some strategies to reduce inflammation, again, in older adults. A lot of it are things that I already talked about, but again, I just really want to emphasize this because they're so important and they work, and usually done consistently and over a longer period of time can really start reducing inflammation and also then affecting your immune system and your immune function. And they're a really good alternative to a long-term low-cost alternative to pharmaceuticals. Not saying pharmaceuticals are bad. They definitely have their place and people need them, but I feel like there's just also a really lack of emphasis on a lot of these natural things that we could be doing right now. So again, nutrition is one of them. There have been some studies on older adults doing caloric restrictions, but I think they were doing this more in obese populations, again, because adipose tissue is very inflammatory and it is an endocrine cell because it releases cytokines, these inflammatory cytokines. So by reducing your weight, your BMI, that's actually one of the best things that you can do for inflammation and just for your health in general. Again, exercise. Exercise, again, when they do the studies, it reduces that adipose tissue and the fat mass, which reduces inflammation. And then the exercise reduces these inflammatory cytokines. For some of the studies I saw with in older adults, the exercise does have to be, I think it was a minimum of 3 times a week for 45 minutes. And they found that if you stick to that, you know, if you did a little bit more, and it has to be like you have to be in between a certain heart rate as well too, then that over a period of 6 months or more actually showed the most benefits. They found that if it was a shorter duration, if it was 6 months or less, then they didn't show as much benefit, even though I think that they would still get benefit. That's what I was talking about here. So it's the 45 minutes 3 times a week and 40 to 50% of the heart rate reserve at minimum. And then I put the calculation down below on how you did that. And exercise training also increases your vagal tone, so your vagus nerve, which is super important in that gut brain connection. And remember, your gut is like 70 to 80% of your immune system right there. So you want to make sure your gut health is really good, that your microbiome is really diverse, and that you're eating a lot of these fruits and vegetables, which is where you get a lot of your diversity in your microbiome if you're not taking things like probiotics. Okay. Oh, this is a study about curcumin. So this was like another good, it was more in the supplement form because they do use it at higher doses, but adding it also to your food can help too. And this was based more on cognition results. So, as you age, that is also one of the things that was contributed to immunosenescence and inflammaging, was this decline in cognitive function. So, and that include things like dementia and Alzheimer's as well too. Oh, and this is another one too. So also with curcumin, it was improving the blood vessels as well too, and then improving antioxidants and that oxidative stress balance. And this is important because, again, cardiovascular disease is very common as we age as well. Okay, and then probiotics. Probiotics are really good as well too. Again, it diversifies your gut microbiota, and they are really important when it comes to anti-inflammatories. They release these anti-inflammatory, they prevent inflammatory cytokines from getting released, and they are really helpful in inflammation, among other things. They do so many things, but they also can help rebalance your gut microbiome, which then can help push you more towards an anti-inflammatory pathway rather than an inflammation pathway. And it also helps your immune system. They're really important in your immune system. And this is another one, the fiber and short chain fatty acids. So short chain fatty acids are another part of your gut health that is really important. And they help with your immune balance as well too. So there's acetate, butyrate, and propionate. And these are the three main short chain fatty acids. And what they do is they help modulate the immune system in your gut. And then that can help a lot of the inflammatory diseases. And this one study I found, it says it helps prevent lung inflammation and asthma, which would be super helpful right now. It also helps regulate your T regulatory cells. So that's really important in helping balance your immune system. They basically determine whether immune system goes overreactive or if they are suppressed and really don't do very much if they're deficient. Another supplement that does that is vitamin D, or another vitamin that does that. So short chain fatty acids also do that. And they help regulate the gut barrier because they actually provide energy source for those cells. They protect against any gut bacterial pathogens, and the COVID-19 can actually enter through your gut as well too, or can affect your gut. You can get like gut issues as well. Can also balance your insulin sensitivity. So again, metabolic disease is super common just in the US in general, and really inflammatory, and you can have worsened outcomes with this virus as well too. So anything to help manage your blood sugar levels are really important, and it can help control your appetite and weight if that's an issue for you, which it tends to be as we get older. And the way you get short chain fatty acids is through the bacteria fermenting the fiber that you eat. And a lot of times this fiber is from things like vegetables, grains, fruits. And then acupuncture, I had to put that in. So acupuncture, particularly in the studies, they look at electroacupuncture, is really good to help with rebalancing your immune system. They're showing it for inflammation as well too, but it's more inflammation with pain. But acupuncture is great for pain. There's a lot of studies on that, but they're coming out with more studies about just inflammation in general, and why certain points are help with this inflammation and help with decreasing these inflammatory cytokines. Okay, and then managing stress. So this is a super important one. You probably hear everyone say that all the time, but really any way that you can figure out how to manage stress that works for you is the way to do it. There's of course, eating a healthy diet, avoiding things like processed foods and sugars, Those are also tend to be really inflammatory. I know when people get stressed, they tend to eat a lot of carbs or a lot of sugar, but that actually can start this really vicious cycle of getting this serotonin hit, and then they come down, and then they start getting these food cravings, and then they want it again. And that's just kind of also perpetuating this inflammatory cycle. But yeah, just laughing, having hobbies, staying in touch with people. There are herbal medicines that you can use, so Western and Chinese herbs that are really good for stress. You can also do things like meditation, sports, yoga, Pilates, walking, running, instruments, and just, of course, spending time with people that you enjoy and that you love. Social isolation as well too is a really big issue when it comes to older adults. With the pandemic right now, we're all kind of isolated, but the studies that I found, just as we get older, like older adults tend to get isolated, not because they want to, but because of like lack of transportation, or family members not being around, and that can actually cause a lot of health issues as well too. So it can create a lot of inflammation. A lot of the things that the immunosenescence and inflammation can actually be caused by social isolation. So that's why it's really important to make sure that you have a community, that you have support. And if you don't have that, that you reach out and ask for help and look into that as well too. Okay, and I think that's it for the slideshow that I have.
All right, great. That was
I
30
think
slides? You went
so.
through?
Yeah, I don't, it was 30-ish,
Yeah.
maybe like 20 something.
Great.
I went through them pretty quick.
No, I took a lot of notes here. Yeah, on your last point about the whole social isolation, I know you did a post, was it yesterday, about that?
Oh yeah.
It's a big thing because, and I talked about it with a few of my other guests the past few weeks, and ultimately social isolation, it causes stress. And when you cause stress, then you are lowering your immune system. So things like meditation, things like breath work, things like laughing helps a lot with that, getting sunshine. And then next week I have a guest, Jeremy Stillman, who is a hypnotherapist, but also he's a practitioner in the local South Bay area that I've used before. Highly recommend him. And he's seen definitely a huge increase this year of just stress-related issues, clients. And because of that, then they're getting sick, or they're just, again, it's just like there's depression that happens. So that's I'm glad you brought that up. In regards to the immune system, yeah, I mean, as you get older, there's this definitely a correlation that as you get older, your immune system goes down, and then as your immune system goes down, the efficacy of any kind of a drug or any kind of antibiotic, or a vaccine actually goes down as well, right? So we don't know, because this mRNA, we don't know what is going to affect longer term, but also with the older population. And what's interesting with the vaccine itself, it's actually inside a lipid molecule. It's a lipid molecule, so it absorbs faster into your cells, which is pretty interesting. So we'll see what happens. They're starting to, especially in the South Bay now, I know a little company in Mary, they're starting to give the vaccines to their workers. I think starting tomorrow, and on Friday, they're going to start giving it out.
Yeah, I think that's the thing, is that we just don't know, like there's just no long-term studies on this. And it's not even with this vaccine, like just things like the influenza vaccine. There's not a lot of studies on this in an older population, and how that, how they mount an immune system, but it's like recommended every year. But it's like, it's like, well, maybe we should like study that and like look into that a little bit more.
So as a naturopathic doctor, how would you summarize what you do versus what an MD does?
I think, well, there's some really good MDs out there, so I don't want to like, bash the profession. I think we work really good together, but just based on like, from my experience and like my friends who are MDs and like patients, what they tell me, I think we tend to look at the whole picture, like the big picture. A lot of what right now, like allopathic medicine is very I can never say this, they're in compartments.
Oh, compartmentalizing.
Yeah, thank you. So they're separated, so they kind of stick to their specialties. They never really kind of combine everything, like for example, with autoimmune diseases, you can see a rheumatologist, you can see a gastroenterologist, you can see like a hematologist, all of those are autoimmune related, but they're not really connecting all of it, and I think as a naturopathic doctor, we're able to kind of connect the big picture, and then we can make recommendations on both sides. We can tell you like, okay, you're doing these pharmaceuticals, like, okay, we understand those. These are some of the natural things that I see that you're not doing that you can work on as well too, and kind of combine both of them together and then see what happens. I think that's what's awesome is that we understand both, and because we're familiar with both, we can combine both of them and really come up with a more comprehensive treatment plan for a patient rather than just, hey, this is what the protocol says to take if you have XYZ. So here's the pharmaceutical and you just stay on that for life, instead of like, well, what actually caused that? So we're trying to figure out like that root cause, like, what is that from? Like, is it from like these infections you had when you were a kid? Is it from like mold? Is it from your immune system just going haywire because you have all these food sensitivities that you don't even know about? So it's like we get to kind of break it down a little bit more.
Oh, nice. Yeah, I look at, to use your words, to compartmentalize.
Yeah, it's a hard word.
Doctors or MDs are typically more specialized in the areas. What you do is slightly broader, looking at a larger picture. And I think the broadest is functional medicine. Functional medicine looks then at your environment as well.
No, we do that too. Did you know functional medicine actually came from naturopathic medicine?
Right. Yeah, I learned something new.
I know, right? So they actually came like our naturopathic, I don't want to say founders, whatever, but elders actually created functional medicine or helped create that for the MD community and create like integrated practitioners. So so a lot of what they learn come from our roots. Like it's still really different. But yeah, no, we take into account all the environmental stuff too. So, and emotional, so relationships, spiritual. I mean, there's a lot of times I see patients and I'm like, you're not going to get better because you're just in a crappy relationship. It's like, you got to reevaluate that, and that's what's making them sick, so then you're like, what do you tell them? Like, you could stay on this medication or you can start really, kind of go inwards on that and look at that. And then, I mean, I don't do that. I would refer them to someone to help them do that. But, it's like we're able to kind of look at all those things and take that into account and see how that affects their health.
Yeah, because so much is you're affected by your biology, right, and your environment. Well, in what you're saying, it's like, okay, if you're affected by your family members, it's like you can't really change your spouse. It's like, okay.
I mean, you could, but like, most people are not gonna they're not gonna like divorce someone.
You're not gonna change spouse.
Yeah, so then it's kind of like, okay, well, what can we do right now to help you manage what's going on? And then, give you time so that you can figure out how to address that root cause, whether it's going through some kind of therapy or, group therapy, like couple therapy, or, kind of giving them time to figure that out while helping them with their current symptoms that they have.
Can you talk a bit more about autoimmune diseases?
Mm-hmm.
That's your specialty. So what type of like Hashimoto's, one of those. Can you talk a bit more about what it is, and then how do people sort of figure out what if they have an autoimmune disease?
Yeah, well, I think that's the thing. Like a lot of people don't know, and they don't find out until they end up getting really sick. And so, they go to different doctors because they're not feeling good, right? But then they get their labs back and everything's normal. So their doctor's like, "You're fine, go home. I'll see you in a year." And they're like, "No, but I don't feel good," And a lot of times these kind of basic antibodies aren't screened, unless the patient like really pushes for them. So, sometimes it takes up to, I think the statistic was like 6 or it's somewhere between like 6 and 20 doctors or something before they actually get a diagnosis with an autoimmune disease. And it can take them decades before they get a diagnosis as well too. So that whole time, their immune system is slowly attacking their tissues, so like say for Hashimoto's, you can have antibodies and not have any symptoms. So you can start manifesting antibodies anytime really, 20s, 30s. And whatever that trigger is, so the trigger could be like food, like gluten's a big one, dairy's a big one. The more you eat that, every time you eat that, your immune system overreacts. You create more antibodies. Every time you aggravate your immune system, those antibodies, they're already attached to the tissue. So then they go ahead and attack that tissue. You start getting more decline in your thyroid. And, eventually it gets to a point where people are just so sick that they're finally getting tested, and that's really not how it should be. It should be like a screen that people just get, because autoimmune it's really common, and you can be in stage 1. So stage 1 is when you have antibodies but no symptoms, and your immune system's already reacting because you're creating antibodies. It shouldn't do that. You shouldn't be creating antibodies to your own tissue. And so you have to find the trigger. So that's the best place you want to find autoimmune disease. Stage 2 is when you have autoimmune diseases and some symptoms. So like you start getting general symptoms like fatigue, like why am I always tired? Like, you start getting GI issues, like just very general things. Stage 3 is when you have a very overt symptoms, very obvious, and you have antibodies, and that's when people usually get diagnosed. But again, that can take, from stage 1 to stage 3, that could take people decades, or it can take them a year, depending on whatever that triggering their causes. For a lot of people it is food. Some people it is a lot of underlying diseases or viruses, things like herpes. Mono is a huge one. So things like that. And again, they get stuck in their specialties. So people go to the gastroenterologist because they're having GI pains, and they don't test for things like antibodies. And you can have antibodies to anything. So, and having antibodies doesn't necessarily mean that you have a really bad, that you have an autoimmune disease, or that you have a like really bad immune destruction. Like antibodies don't test that. They just tell you that your immune system is reacting, and that you got to figure out like why it's reacting to that.
Yeah, so it's really it's a long journey, is what you're saying.
Yeah.
They should come see you.
Yeah. Autoimmune disease is really complicated, and you can have they test, I think, older adults, and they have antibodies, but they're fine. They don't have any autoimmune disease. Again, it's just it just depends on your immune system. If you have antibodies and then your immune system reacts to those antibodies, then you start getting disease. You start getting a lot of symptoms and tissue destruction, but if your immune system's good, like it's balanced, you can have these antibodies, but then it doesn't do anything. Immune system doesn't react to it.
Great. All right, we got some questions in the chat. Lillian asks, what kind of curcumin is good?
You want to get a liposomal curcumin if you are trying to use it like systemically. So because the fat helps it absorb. So you need the fat to help it absorb. If you're trying to do more of like, you say you have like gut inflammation, you want to use it more for gut issues, the liposomal is good, but then you can also just use like a powder form, like just regular powder, like turmeric or curcumin, and that doesn't get absorbed as easily, so it stays on the surface of your gut, so then it helps like inflammation more on that surface. But if you're looking more for like systemic, you want to get like a fat soluble curcumin.
Yeah.
Can you hear me?
Yeah.
Oh, yeah.
Oh, okay. So for the curcumin, you can see all these different ads they have on TV and stuff like that. So the powder that you take, that will help with gut inflammation, and it doesn't matter like the milligrams or anything like that.
No, that dosage matters for sure. But then you also want to be careful of where you get it from. Like when you talk about the herbs, like how are they processing these herbs? How are they growing the herbs? Are they using pesticides and herbicides? Because then you ingest that, and then again, that's an environmental toxin that could be causing basically causing inflammation that you're trying to stop by using the curcumin. So, you want to know your source. You want to know how they process it. And then dosage matters.
Right.
So,
Can you
like a brand?
Yeah.
No, but I can tell you what I I can tell you what I use.
I can tell you what I use.
Yeah.
Okay. Okay. What
Educational purposes only.
Yeah. I
What
can't
type-
recommend anything, but I really like, for example, Designs for Health.
oh yeah.
I like their curcumin. They're really big pills though.
Oh.
So if you don't like big pills, then you might want to try a different one.
Do you can you recommend one with a powder? Are you saying that they have turmeric in it? that
So curcumin is a constituent of turmeric. So turmeric is the actual plant. Yeah.
Oh, okay.
Yeah. So if it's turmeric, they might have other things in it besides curcumin. Curcumin has, if it's just a curcumin supplement, has been isolated. So then it's just a curcumin. Yeah.
Brian, do you have a recommendation on a curcumin powder? So I don't have to take a horse pill. It's actually for my mom.
Well, you're better off actually taking the horse pill because the curcumin powder it's the yellow dye. It'll dye your mouth.
Oh, we don't want
So
that.
you're better off the pill. Yeah.
Actually, I've had that happen where I had the liposomal pill and I put it in one of my pockets, my shirt pockets, and I forgot about it. And then I washed it and it was like yellow stain. Oh my God, it was horrible.
Oh, there's Lisa. Lisa has a question.
Glowing. Do I have a question? Well, so I made this paste from turmeric powder and coconut oil. There's like a recipe, and I put it in a jar. I also put it in like ice cube trays and I froze it. Does that affect the efficacy if you freeze it or?
I'm not sure because I'm not sure like what kind of
What I'm
powder.
making, yeah.
Yeah. But I know for some herbs, like freezing it actually makes them better, but I can't remember off the top of my head.
Okay.
Yeah.
Well, I'll give you some.
Okay. Okay. Oh, thank you.
Lillian, you can get some yellow ice cubes.
I know, right?
It doesn't freeze.
Yeah.
Especially if it's
And then I have one more question. So what kind of recommendation for any type of herbal teas or any type of minerals would you recommend for inflammation, gut inflammation?
Like herbals?
Herbs or teas or minerals? Turmeric tea, I'm assuming, is good, right?
Yeah. Depends what's causing the inflammation.
Yeah. What if you don't know?
You gotta go see Nicole.
Yeah, you gotta go see me. Because say if it's like you're having like gut issues or inflammation from like something that's kind of bacterial or viral or yeast, like all those things you probably want to use different herbs for. So yeah, but
okay. How do you
test for that?
Uh-oh, you're frozen.
Lillian's frozen.
Oh, Lillian, you froze.
Oh, there she is. Honey.
Yeah, how do you test for that? Where it's coming, what's causing it?
Oh, so you can get like stool tests. If you're looking for like gut inflammation, you can do stool tests. If you're looking like, say, if you're concerned if you have something like SIBO or things like that, you can do like things like breath tests. But yeah, most likely probably a stool test.
Okay, perfect. You answer questions.
Mona, go ahead. Mona, speak up. You're kind of quiet.
Can you hear me?
Almost.
Gee,
A little closer.
I the other day too. I kept
Yeah.
talking.
Your mic is quiet this time.
Is that higher?
No.
Huh.
More.
I'm looking for, I have osteoporosis and I don't, can you hear me at all? I have osteoporosis and I don't want to take any drugs. And I'm looking, if you have any, I was taking strontium. I've been taking strontium for years, and it always worked. But now I'm reading all these things that it's not so good, and I don't, and nobody knows the effect of taking it for 30 years. And so I'm like afraid to take it all of a sudden. But I'm taking, lots of calcium and D3 and vitamin K and all that stuff, and I'm doing OsteoStrong and doing an exercise every day. But I want to improve it, but I'm not going to take drugs. Do you have any herbal things? This acupuncture doesn't help with that, does it?
Usually if it's more of like structural changes, like acupuncture is not as helpful. Like structural changes to your body. Yeah, I think with the OsteoStrong, what they're doing is really good for helping building bones.
Do you know anything about strontium citrate?
Not off the top of my head right now, but I know for like bone health, things like the things you mentioned, like vitamin D, vitamin K, magnesium, calcium, like all those things are really important. And also, you kind of want to look into your hormone health as well too. Inflammation can be important. Weight bearing exercises, things like that.
The hormone thing, I had a little bit of DCIS1 in my right breast, and they took me off of Provera and Clemen years ago, and they still said I shouldn't have any hormone thing. So yeah, I'd love to do that, but I can't.
Yeah.
That was 15, 20 years ago too. I don't know why I can't do it now, but no doctor will say to do it because they don't want to open themselves up to if I did get cancer from it, So
yeah.
But I just wondered because it's like I'm taking I've taken 1,000 milligrams of calcium, but your body only takes 500 at one time, and so then because I was taking the strontium on an empty stomach, and I take the calcium D3, K, and magnesium later in the day. But then those people at Alpha Cal said that you shouldn't take that much calcium all at one time. And so I'm sort of spreading out, but I don't have any really, concrete pattern right now of what I'm doing.
Oh, yeah, I know. I mean, just with supplements in general, if you're taking, there's some things that, in your body that have to be running smoothly as well too. So, you have to make sure your gut is good, because if you're taking these supplements orally, if the microbiome in your gut is not good, it's going to affect the absorption and also how they use it, because they actually help break it down too, along with your food, to create these byproducts. And also like your kidneys, things like your liver, have to be functioning well. And you want to make sure that they're okay, especially if you're taking higher doses of like minerals, because then that can cause some other side effects as well too.
Right. And I was going to ask you about probiotics, because I started taking those every day, but does that turn off your natural body from making its own friendly bacteria if you take probiotics every day? Because they're good for you, but you're taking them every day, so you're not letting your own body make them.
Well, I think the only bad thing I can think about with taking a probiotic every day is that you're only getting like certain strains. So again, it's like limiting the diversity that you're getting. And when it comes to the microbiome, you want it as diverse as possible. So, and that comes again from food. It comes from just your environment, like your local environment. So out in the dirt, the trees, it can be from supplements. With the supplements, you're just getting high doses of like basically the same, strain. So that can limit the diversity. So really, when it comes to the microbiome, you just want it as diverse as possible.
Mm-hmm. Yeah, okay. Yeah, because even Dr. Wong said, he's the one that told me to take this probiotic, and he said, I think maybe we should look at that, instead of taking those every day, doing something different, like,
Oh, like getting dirty in the dirt.
Well,
Yeah,
getting-
uh,
my own.
what Nicole is saying is that it's about your gut biome diversity. So even if you're taking a particular brand, there are thousands and thousands of different types of bacteria, and especially things like yogurt. It's a very particular one, and all these different brands, they all use the same strand, and you want to have a lot of diversity. So even things like as you're buying foods, you can eat. Again, this is what I do. You can eat food that has soil in it and dirt because you actually do want that. You don't have to wash everything.
So like spinach, instead of trying to get every piece of dirt off the
You want stuff that builds your gut.
yard.
It all depends on how healthy your gut is, right? So you want that diversity. So there's a whole movement now of people getting more dirty, right? They're cleaning the dirt so that they get exposure.
Oh, that's interesting.
Mm-hmm.
Yeah,
Yeah.
I just violated something just before this because I got home at about 5:15, took the dog out, ran in, I was starving, and so I made up some spinach and mushrooms and bell peppers and all this, and I just ate so fast that I almost have a stomach ache, and you shouldn't eat fast like that. I was like, oh, I gotta get to the back up. Gotta get over here at 6 o'clock. You're supposed to eat slow, otherwise it messes up your stomach, doesn't it? At least that's what they tell you.
You got to chew like 20, 30 times before you swallow.
Yeah, exactly.
Definitely want to chew.
So you can eat healthy food, but if you jam it down, you're defeating the whole purpose.
Great. Any questions? Joy, anything, or Lisa?
I wanted to introduce you to my cousin Joy. She's over there. She just joined Strong in Hawaii.
Muted, Joy.
Right there. Joy, say hi.
She, wait, where is she?
Oh, wait, she's
Joy, you're
muted.
muted.
Yeah, she's muted.
Unmute it, Joy. Unmute yourself.
Yeah, I have a question. I just joined OsteoStrong because I have osteoporosis. And in addition, I'm taking tamoxifen for breast cancer, like prevention, I guess prevention. So I'm wondering, is there anything I can do diet-wise other than OsteoStrong? Is there anything that you can recommend? Or should I even check my estrogen levels? Like, is that recommended?
So like I said, I can't make any recommendations
Yeah.
to people who aren't my patients. But if I was in that situation, so what I tell women just in general is that it's important, to get a baseline of what your hormones are.
Okay.
I mean, that's something you want to know, especially if you're taking medications that could be altering that level. I think it's important to know just health-wise, immune-wise, kind of like we talked about, bone health-wise, brain health-wise, all that's really important. And even your microbiome has something called, I think it's called estroblooms, which actually help process the hormones. And it's the same with when it comes to nutrition. You just want to make sure you're having a really healthy, diverse amount of foods in your diet, all the colors. I always tell people try to do organic as much as possible. And again, with diet, it's hard because it is individualized depending on that person. So kind of like what I said before, you want to eat a diet that doesn't give you any symptoms. So for a lot of people, that usually involves a lot of colorful organic fruits and vegetables, some kind of meat. Again, I always say like 100% grass-fed organic meats. And also for a lot of people, they have to avoid, those high inflammatory foods. So things like processed foods, sugar, a lot of the high inflammatory foods like grains, corn, soy, what else? Dairy can be super inflammatory for some people. Any really processed foods in general, they have a lot of like these saturated fats and things that they're just not good for people, and it causes them a lot of inflammation. And so really anything you can do to decrease inflammation in your diet, in your environment, in your life in general is just going to help you, because it's all going to, they're all these little things that are going to work together and start making a bigger difference. And, you know, a lot of times you won't see it right away. It happens over time. And and I'm not talking about like a lot of time, you know, for some people who do this like really gun ho, I mean, they'll start feeling and seeing these results a lot sooner, you know. But most people, I tell them, you know, give it like 6 months to a year, you know. If you're under this chronic, if you have these chronic aggravations going on, whether that's from work or from family or just life in general. I know it's hard right now with the pandemic, you know, a lot of people watch the news and they get triggered. So when you have things like that, you know, that can just put you like a step back. So, you know, all these little things you're doing, and it might just put you like a little bit back. So it just might take a little bit longer, you know, but you're still moving forward. So that's like the whole goal, you know, like if you start here, you might be here, you go down here, but then you go back up here. So, you know, you're constantly moving up, and that's really what you want, you know. So a lot of these things compound over time, and the longer you do it and the more you can stick with it, like the more results you're going to see. And then when you figure out like for you what these root causes are that are leading to, a lot of times it's just a lot of this inflammation that trigger these diseases. And if you can figure out like your particular combination and your trigger, I think that's like key. And then you know, and that can change over time, but it gives you at least a baseline to work from.
I think for me, it's like, it was like estrogen, you know, my hormones are, I guess, I don't know if they're elevated, but that's the cause of my breast cancer. So I have to be careful about estrogen. So that's why I'm on tamoxifen. So I've done all of that dietary changes. I only try to eat organic. I tried to do whole food plant-based, and it's been about a year, but I had to add in chicken and fish because I didn't have enough protein, and I was losing too much muscle and weight. So then the doctor said I lost too much weight, so I have to bring my weight back up. So I've been trying to do that, like eat more like organic chicken, salmon, wild salmon. Some once in a great while I eat meat, but rarely, because I guess for cancer they said to avoid meat if possible, or if you do eat, it has to be grass-fed.
Yeah. So
and I eliminated dairy, gluten. Yeah, that's what I've done.
Cancer is actually kind of similar in a way to autoimmune diseases because they both affect the immune system. But you know, a lot of things that you mentioned are good. And I think one thing that especially women forget as we get older is that, you know, it's really important to, you know, involve like exercise and like muscle as well too, like muscle mass. And I think that's where, you know, that like OsteoStrong is really good. Because I know it's hard for women to build muscle mass sometimes. But that's a really important part of just health in general that I don't think really gets emphasized. You know, diet and nutrition and all that does too, but you know, exercise and resistance training and muscle building is super important, especially as you age. Like you want muscle. Yeah.
So hopefully OsteoStrong will help that.
Yeah, no.
I just started. Thanks to Lily. Lily told me to join.
Oh, good. Yeah, it would be interesting to see like your results, you know, like if anything changes.
Because I started out having osteoporosis already. Like but I'm not to the point that I'm supposed to take medicine. I mean, you know, but technically because I'm on tamoxifen, they want me to take some kind of calcium, but I also don't want to take medicine if possible. I want to do it naturally. So I was trying to do diet and like OsteoStrong, exercise every day. I've done that, I think almost, not quite a year, but every day I exercise, do your, what is that? Qigong, I walk, I meditate. I mean, I've done a lot of things I'm trying anyway. And dietary wise, I think that's the biggest thing is I changed my diet and exercise, of course, those two things. But and I have to see how it goes with after a year. I think it takes for OsteoStrong to see if you have changed your bone density. Because it's been, I think my last DEXA scan was in 2019, so it's usually every 2 years.
Yeah.
But if you have any advice for supplements, like I do take like calcium and D3, but if there's anything else I can take.
Oh, I can't give
Oh, yeah,
recommendations
advice.
over.
Right,
But if
right,
it was
right, right.
you, what would you do? What would you
Well,
take?
I think a lot of the supplements like I already mentioned are really good. They're just really good basic, I think, supplements.
Okay.
If you're looking for more specific, like I can't give you anything on
Yeah.
here, but
Yeah.
there's a book by another ND that I think is really awesome. It's called Out of the Box Cancer Therapies.
Okay.
And he goes, and that's by Dr. Paul Anderson, who's an ND, and he goes into a lot more detail that it's more specific on things
Okay.
you can do.
Okay. I also see a naturopath. It took me a long time to find one, but I did find one on the Big Island of all places.
Oh yeah. Oh my
Have
gosh.
you, Dr. Traub? Have you heard of him? He's
Yeah, so
awesome.
he's a cancer specialist.
Yes, that's why I got to
Mhm,
see him. I love him. He's been wonderful.
mhm.
Yeah.
Yeah, he's been an ND for like a long time, like
Yeah,
a really long
he
time.
did. He has been. He has been. And yes, because I was searching for him for so long because I wanted to do conventional and alternative in a sense, like
Mhm.
combined together. But a lot of other not naturopaths, but a chiropractor is another person I consulted. They don't want to. They just say you got to do it this way. That's the only way you can do it. You have to go against your doctor's advice. I didn't want to do that. I wanted to bring the two worlds together.
Mhm.
Basically, I think that's what naturopathic medicine does. It puts
Mhm.
conventional alternative and
Mhm.
combines the two. So that's really helped me a lot. That's
Yeah.
been awesome. Yeah.
Yeah, no, Dr. Traub is awesome. And like in
Yeah.
Hawaii, so I actually have my license in Hawaii too. And when I first graduated, I actually worked in the Big Island in Hilo.
Oh my gosh.
And in Hawaii, actually, our scope of practice is a lot bigger than it is here in California. So we can prescribe, medications. Here we need, for particular medications, we need a doctor, an MD to supervise us. But in Hawaii, you don't. So we have a lot more scope. Our scope of practice is a lot bigger. So it makes our toolbox a lot bigger, like all the things that we can do.
Oh, right.
Yeah.
I'm
So yeah.
thinking, yeah. Oh, cool.
Yeah.
Yes,
No, he's a
really
great ND.
I really like him. Yeah. And he actually was with the hospital where I grew up in Kamuela. He started there.
Oh,
Yeah.
cool.
And
I
North
like Kamuela.
Kohala, I think it's called North. Anyway, it was under Dr. Bakken. He was the one that invented the artificial heart. So he sponsored the hospital. And then they had this vision to do complementary medicine. So he was in charge of that department at one time. But anyway, long story short, I was looking for someone and my friend was going to him on the Big Island. So she told me about him. So that was like awesome. I didn't even have the language for what I wanted at first. Like I didn't even know about naturopaths, functional medicine. I learned so much in the last year. So it's been amazing. Yeah. And then
That's awesome.
like even finding OsteoStrong, that was awesome. Like I was looking for something like that. And then Lily told me about it. So that's like really exciting because I'm so hopeful I don't have to take like IV medicine because they're going to put me on Zometa, which is an IV, medication for, so I didn't want that. So anyway, I'm hopeful. I'm really hopeful that it's good.
Yeah. No, when it comes to cancer, there's a lot you can do. And if you decide to do like conventional medicine, there's a lot you can do conventional medicine wise along with natural like therapies for cancer. It's not my specialty because there's in our profession you can actually specialize in that, and I think that's what Dr. Traub does. I think and so you really want to find someone who specializes in that. So that's great that you did. Yeah.
Yes, I'm so glad. I'm so glad I found him. Yes, he's been really, really helpful. And it's amazing you know him.
Yeah, well, I don't know him, but he just in our profession he's well known.
Yeah, he's been doing it for a while, I heard. Yeah, that's awesome. Thank you. That's helpful.
Right. Let's see. Beth, any questions? or Lisa, anything? No?
Hello.
You don't do any homeopathic remedies or anything like that that would
No,
go, that would have some, that would help with bone health that doesn't, it's not a drug?
I don't use homeopathy as much. I use it more acutely. I don't use it constitutionally. So yeah, I don't, that's not my main focus of my practice, although I know some NDs that focus more on homeopathy. Yeah.
The herbs, do you work with different herbs, herbal concoctions or something? Why, you can't recommend things. Why is that?
Just because it's like a legal issue. So unless you're a patient, I can't make recommendations to you because then,
Doesn't know.
yeah, because I don't know your medical history or like, and then if you take something and then something, based on my recommendation and something happens to you, then technically I would be liable.
Even if it's a vitamin?
Yes.
Really?
Yeah. I know it's surprising. Yeah. A vitamin, even water. If I told you to drink a specific amount of water a day, and if you had a kidney issue and something happened to you and I didn't know about it, then technically I could be, that could be considered malpractice.
That's because we live in a Sue hungry country or something. I know that's awful.
I know. It's really sad. I know. Yeah. If not, yeah, I would totally tell everyone all this, everything. But yeah, I
The
can't.
call needs to go see Nicole then. So Mona, make your appointment tomorrow. Well, great. Any other questions? I know we're at top of the hour here.
No, thank you.
Thank you so much.
Yeah, thank you. That was so much fun.
All
Thank
right. Well, thank
you.
you. Thank you,
Bye-bye.
Nicole. Okay. Next week we have Jeremy Stillman, the hypnotherapist, talking about stress relief and social isolation. So a very, very good topic next week. It's about mental health. And he'll talk about breath work and meditations and maybe hypnotize us. We'll see.
Oh.
We'll see. All right. Well, thank you, everybody.
Thank you.
Great.
Thank
Thank
you.
you.
Bye.
Brian.
Bye.
Bye.
Bye.